Nice to see you, Andrew.
Good to see you, Hassan.
We're going to talk about the stem cell therapy, which we've done back on the 1st of May 2019. We assessed because you have massive rotator cuff tears
Yes.
and some osteoarthritis of your shoulders. And I just want to see down the line what's happening. So going back to the time where you had the stem cell therapy, what made you go for experimental stem cell therapy?
Okay. Well, I viewed it as being my last option to get some movement back into my shoulders, because I damaged my right shoulder probably 10, 15 years before I had the stem cell treatment, and the injury or the damage was so great that I wasn't able to have surgery, according to a couple of orthopedic surgeons. So we were talking to some people on a train in south of France, and
Yes.
and they'd had the lady had stem cell treatment in Melbourne, and she swore by it. She had one of her knees done, and she was going to get the other knee done, and she said it just gave her so much more movement in her leg joint.
So she encouraged you.
She really said yes, this was worth trying, you know.
Yes.
And so my wife said, look, let's investigate it when we get back to New Zealand.
What made you go for the therapy in terms of symptoms and functionality? Have you played sport before?
Yes, I used to play tennis, and I gave tennis away because I couldn't lift the racket above my head. So and it was really quite painful. Even throwing the ball up was painful. So I gave tennis away, and I tried to play golf, and I wasn't able to really swing the club effectively because the shoulders were too sore. And when I did hit the ball, it created such a jarring impact on my shoulder that it was just too painful to carry on. So I stopped doing that. And just day-to-day activities like putting a jumper or a t-shirt on or taking it off, you know, lifting your arms up above your head, was quite painful.
What about the night time?
Nighttime was difficult to sleep, particularly lying directly on the shoulder.
Okay.
It was quite sore. Now I do have a little bit of issue. Sometimes it gets a bit painful if I lie
Yes.
too long on one side,
Yes.
but it's nowhere near what it used to be
So
like.
comparing to prior to the therapy,
Oh,
how much improvement?
Oh, I would say, in terms of my full range of motion, I would say I'd be 85%.
Does that make you happy?
And it makes me very happy because
We have single therapy. We have just
Yep.
one-off session.
Yeah.
And then I remember we recorded that 4.5 months post therapy, and there was some improvement.
Yep.
And now you can play golf.
Yeah, I can play golf now.
Day-to-day activities better.
Yeah, day-to-day activities are good. Gardening is good. I mean, I can use the hedge trimmer up here for a reasonable amount of time. I've got to stop and have a rest every now and then.
Yeah, because you don't want to re-injure it.
No, that's right. So
And the other thing, do you take any analgesia or anti-inflammatory medicine?
no.
Okay. And what about physio? Did you continue physio for some years after the therapy, or you just follow any stretches, exercises?
I went to Yusuf at your recommendation after I had the stem cell
Physiotherapist in Howick.
In Howick, yep. And I think I went to him for about 3 or 4 months, just having post stem cell treatment work done on the shoulders, and that helped really well. I was going to the gym at the time as well, and so I carried on with exercises at the gym to try and strengthen the shoulder. I had pretty good range of movement. I could do day-to-day activities, getting t-shirts and jumpers, and even a towel to dry around your back, you know, was really painful. Yeah, very difficult. But
Yeah.
now it's quite easy, you know.
Yeah.
So,
Yeah. Any regrets doing the therapy?
no regrets whatsoever. No, that's the best thing I ever did.
What is your recommendation to other?
Well,
Clients.
I would recommend giving stem cell treatment a go.
It is recommended as a long term to use a resistant band that they just buy from Rebel Sport or so,
Yep.
and that will actually they call them recovery bands, so they can use long term. That will prevent any further injuries and make your
Make it
remaining
stronger.
muscles
Yep.
stronger.
Yep.
Yeah. So
Yep.
the healing process is long term.
Yep.
It might not be perfect, might not bring the joints and the tendon to a younger age, but the best available option.
That's right. Yes. Yeah. 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 Yeah.
And your job was before a fireman, eh?
That's right. I was in the fire service.
The
Yeah.
fire service.
Yep,
Yeah.
Yep.
And did you have any trouble during?
Because of my position, I didn't. Because I was in the management position, so I didn't have to carry heavy equipment
see.
around and do that sort of thing. Had I been in that situation, I would have struggled to do the job. Absolutely.
I see.
Yeah. Yeah. So.
Thank you very much, and I wish you well.
Thank you, Hassan.